Hey guys, this is Mohammed Nadeem with another video on soft learners. In this video, we will classify receptors into two basic types. Consider it a cell. In this cell, two types of ligands will act: a ligand A and a ligand B. Now we have a ligand A and a ligand B. Consider ligand A to be of large molecular weight, or it can be highly charged. Ligand A is large molecular weight or it is highly charged, while ligand B, it is of small molecular weight or it is lipid soluble. Ligand A is large molecular weight and it is highly charged, while ligand B is small molecular weight and it is lipid soluble. As we know, large molecular weight molecules, or which are highly charged, they cannot cross this cell membrane. So their receptors should be present on the surface of the cell membrane. Their receptors should be present here. While we know that small molecular weight molecules, or which are lipid soluble, they can easily cross the cell membrane barrier and can enter into the cell. So their receptors should be present inside the cell. Their receptors should be present here, inside the cell, inside the cytoplasm, or inside or on the nuclear membrane. So the molecules which are of large molecular weight or which are highly charged, their receptors, they cannot cross the cell membrane. Their receptors are present on the cell membrane, while small molecular weight molecules or lipid soluble molecules, their receptors are present inside the cell, in the cytosol or on the nuclear membrane. Now, there are many examples of large molecular weight molecules. Now we will discuss examples of large molecular weight ligands, large molecular weight hormones, large molecular weight drugs. Now we will discuss the examples of the large molecular weight ligands. Large molecular weight ligands. There are many examples of large molecular weight ligands. For example, as we already know, insulin. Insulin is a large polypeptide hormone. Apart from that, our growth hormone, prolactin, follicle stimulating hormone. They are all large molecular weight ligands, so their receptors must be present on the cell membrane. While there are also examples of highly charged ligands. Now, highly charged ligands, for example, catecholamines. In catecholamines, there are present epinephrine, norepinephrine, and dopamine, and so on. There are epinephrine, norepinephrine, dopamine. They are highly charged ligands. They cannot cross the cell membrane because of the lipid present in the cell membrane. So their receptors are also present on the cell membrane. Now there are examples of some ligands which are lipid soluble. For example, all the steroid hormones present in our body. The examples of these are, as you guys know, testosterone, progesterone, estrogen, aldosterone, and many others like vitamin D, cholecalciferol. They are all lipid soluble, so they can easily cross the cell membrane and can enter into the cell. So their receptors must be present inside the cell. Now, apart from these, there are some examples of the ligands which are of small molecular weight. For example, the T3, T4, present in the thyroid gland, and the retinoids. They both are small molecular weights. They can easily cross the cell membrane and can enter into the cell. So their receptors must be present inside the cell. This is all from this video. In the next video, I'm going to show you how receptors are broadly classified on the basis of their protein nature. But before you move on, don't forget to subscribe our channel, Soft Learners. Thank you.